To put it bluntly, the show where the canna-curious go for straight talk on cannabis. On this podcast, cannabis and pain management.
Using cannabis to manage cancer pain is ancient history. But what is new is actually using it for PTSD, using it for pain, even a bum back. But how do we know what's snake oil, what's a placebo effect, and what is really good medicine? To help us learn about that today, we have a great panel with us. Over here on my left, I have
Missys McDill. I am a cancer patient at the time, and I also am an aging boomer, so I have pains that come from just growing older.
My name is Alison Ettel. I'm the CEO and founder of Treatwell, and I actually use it for a lot of my pain. I use this coming out of meningitis from a coma.
My name's Sarah Blankinship, and I'm the CEO and founder of RightSciences, and we make plant-based transdermal patches for wellness and relief.
And I'm Dr. Jessica Knox. I'm a physician and co-creator of the Canna MDs, which is a resource for patients, as well as the American Cannabinoid Clinics, which is a family-run clinic that treats the endocannabinoid system as a whole to treat pain and many other conditions.
Great. And I'm Whitney Greer, your Canna Curious host, and I have a bad back. So let's kick it off with maybe the doctor here. Can you tell us a little bit about what people bring to you, top of mind? What are the top pain problems?
Yeah, absolutely. And pain is probably the number one complaint that patients come to our clinics with. I would say for most patients it is musculoskeletal pain, so either they've had a traumatic incident at some time in their life and they're now dealing with chronic pain that's sort of residual from that, or they're aging boomers and it's just wear and tear, so they have a lot of arthritis pain. We also see neuropathic pain, which is very common with diabetics or other people who've had traumatic injuries to a joint, and that's sort of turned into pain that goes up and down the nerves. And then also some cancer pain. I would say less of that. It's definitely more so the traumatic sort of musculoskeletal pain we see, but it is across the whole sort of pain spectrum.
You use some of those tinctures, right?
Yeah, it's definitely one of my favorite methods. I do personally use one of Treatwell's tinctures for my menstrual cramps, which is another
that's a big one.
pain sort of domain that I see sometimes. But yeah, I think a tincture is a great mechanism for treating pain.
Yeah, we find it's fast acting and also long lasting, which is what patients are searching for. We also find the most important thing we think about tinctures is it's easy to titrate up. So you can start small, slowly increase to find what works best for you. It's kind of hard to take, less than one bite of a brownie. So this is a very good way of getting around that.
Well, the funny thing about that is when I first tried a tincture, I was told to look in the mirror and drop it under my tongue. Is that how you do that?
Yeah, that's what I
okay.
recommend.
But then I was going like, okay, I did 2 or 3, I feel nothing. And then I'm like, well, besides going like that, how often should you increase it? And I got really confused.
We actually recommend around 3 seconds under the tongue, then swallowing, because we want it to absorb through the mucosal membrane and then also to be ingested, because you have receptors all through your body. So we find it's just kind of hitting it from all angles that way. But it doesn't have to be exact, so don't worry, you did it perfectly. Usually you feel it, 15 minutes to 30 minutes is when you usually feel the onset.
Oh, really? So you should wait. Okay,
Yes.
So this is interesting because I was not told that,
Yeah.
right? So then I'm like waiting and waiting and I'm going, oh, this sucks, I'm going to bed,
Yeah.
right? Let me ask you, what are these here? Because you have quite a few of them.
Sure. The red ones are our acid line. We just launched CBDA, which is my favorite right now for extreme pain. THCA tends to hit a lot of the nerve-related pain. Then we have 20-to-1. These are ratios of CBD to THC. So this is 20-to-1, 3-to-1, 1-to-1. And we found that they kind of target different things. And I say kind of because everyone's different. So we said in general, this tends to treat this, but there's always exceptions.
Okay, I think we need a little explanation here between these and 1-to-1. And I've heard that a lot, but honestly, that's like Greek to me. So can somebody enlighten me?
So when we talk about CBD to THC, that's just the ratio of how much there is. Think of it like a pie and how it's broken up. So everything we do is basically non-psychoactive, except for the 1-to-1, which means 50% CBD, 50% THC. So in larger quantities, this can have some psychoactivity to it.
Okay.
But the acids actually are non-psychoactive. They're the precursor to CBD and THC. Very different properties than what they turn into when they're decarboxylated. Fancy word of saying adding heat.
Okay, thank you for explaining that. This is an on-ramp show, mind you, right?
We're learning.
Yeah, we're learning about it. I want to take notes, right? Well, and I'd be curious to hear, Missy, tell us a little bit about, did you experiment with some of these, Missy, or what have you been given?
Not with this specifically, but I have been using tinctures twice a day. I'm hearing new information and I'm excited to learn about this, but I use tinctures under my tongue. I had no idea. I just got a rough idea of how much to take twice a day, and that was from a somewhat inexperienced non-doctor related person that just said do this and try it, because when I did go to my oncologist to get my papers to go ahead and get this, I said, so what do I take? And she said, well, I can't tell you. I don't have any way to prescribe what you're supposed to be taking. I've never even been into a dispensary. So
wow, that's frustrating.
So you're on your own, basically. And so I learned from, friends sharing information, and now getting involved in this has just been incredible for the opportunities that there might be, that I'm going to learn so much more from you. Just within this few minutes, I'm learning so much.
Well, and I think it's interesting too, because we're talking about tinctures, but Sarah here has the Right patch, which is coming out very soon, and that's a whole nother way of delivering it, right?
Correct. Yes. So transdermal patches have many benefits, and that is, one among them is bioavailability. So we like when you ignite a product or when you eat a product, there's a different percentage of viability. The plant will go into the body at a different rate. And with transdermal patches, that is the most plant material that can be directly transferred into your body, is directly into the bloodstream. And why we created those were because my mom had a stroke and she needed consistent, discrete, simple pain management where she found the experience the same every time. And so we had a hard time finding that on the market, and we created that ourselves.
How does that work?
Right, so we...
And that's over here, right?
Right, so we have...
Show us that.
We have created a line of hemp patches called Seva Patch, and then we have a cannabis line as well called Right Patch that will be available in medical dispensaries. And we create the different types of patches. The hemp patch has a certain milligram that we're trying to achieve of hemp-derived CBD, and then the cannabis patches, we're starting with another dose of THC as well in those. There'll be little patches, about 2 by 2 squares, and they'll go anywhere on your body that has a veiny surface. So I'm wearing one right now. You can't even tell.
Oh my God, look at this.
Right?
It's transparent.
Right, it's transparent, transdermal. You put it on, and within a few minutes, you start feeling the effects. It transfers directly into your bloodstream, and then this product is time release, so it goes into your body over a period of 8 to 12 hours.
So you have to change it every 8 to 12 hours if you want to do continual?
Yes.
If you have like a big chronic issue?
We found a lot of success with people trying these, and then they experience a lot of significant pain relief with no side effects related to THC.
Interesting. And so let's talk a little bit more about the medical properties of that, and why is it working for us and why isn't it working for us?
So, well, Alison and I were sort of talking about this earlier, where every person is different, right? It's a very personal medication. It works differently for all of us. The way I'll try to avoid getting all sciencey on you, but the way cannabis is working in our body, it's working with what's called our endocannabinoid system, which is a system of receptors and ligands that attach to those receptors throughout our brain and throughout our organs, our lymphatic tissues. It's everywhere. And we all sort of have a different, what we call endocannabinoid tone. So mine might be slightly different from yours, slightly different from everybody else here. Part of cannabis medicine is this sort of trial and error. And my job as a doctor is to sort of give you a starting point. So for a lot of my patients, my pain patients, I do encourage them to start with a higher CBD medication, whether that's ingested or inhaled or put on topically. Start there. You can gradually add THC if you need to, and if you're not getting a great fit with that first medicine you start with, you might have to try something else.
Okay, well, while I've got you here, let's just step into your office. Tell me a little bit about what you might start me on here if I'm coming to you with this chronic back pain that I've had for 2 years. I haven't slept in 2 years. Yeah. You know, like, what would you tell me? I love this free advice.
I know, right?
I don't even have to make an appointment.
You're welcome, yeah. So for you, I would say, first of all, for daytime use, I'm definitely going to recommend a higher CBD product. So something that's at least 10-to-1 CBD to THC, and that's because I want you to get pain relief and symptom relief without necessarily getting some sort of head high or feeling out of it. Because that's most of us are working during the day, or we have family we want to attend to. We don't want to be sort of altered. So a high CBD medication should give you some symptom relief without making you feel kooky.
Wait a minute. That's already goes without saying.
Yes, of course.
Okay, well, would it help with inflammation though too?
Absolutely.
Okay, because that's really important.
So it reduces pain, reduces inflammation. And the way that works is that, so actually like at the nerve endings where these pain signals are sort of shooting back and forth, cannabis actually sort of turns down that pain signaling. So your body's getting less of those, ouch, I'm hurting sort of information. And then also at your immune cells, it's also turning down sort of the degranulation and the cells that are sort of releasing more inflammatory products. So you're getting the pain signal turned down, you're also getting the actual inflammatory molecules turned down as well. And so we actually, for you, I would say, probably during the day, I want you to ingest a high CBD medication, and I might also tell you also use a topical directly to your low back. We like to get cannabis in the body and on the body, as we say. And then for nighttime use, I would tell you if your back pain's waking you up, you should try an edible. Start with a low dose. You can do a little bit more THC then, and some myrcene too, like you were saying. Add some myrcene. That's one of the terpenes that is really great for just sort of helping you mellow and relax and fall asleep. But you can go a little bit higher on the THC, so like 4-to-1 CBD to THC. Some people might even like a 1-to-1. But that edible with a little bit more THC will help you go to sleep. And because the edibles last so much longer in their effect, you're going to stay asleep hopefully throughout the night.
So actually now I can give myself permission to eat a brownie every night.
There you go.
And then will it continue to work for you? I mean, do you have to change it up every so often, or is there
Depends.
like a...
Depends on the extraction process. It depends what medicine you're actually using. We found that it tends to be CO2 extractions. You tend to actually need more over time. We found with our extraction method, no. Usually when you find your dose, that's your dose. All things being equal, but things can change.
I'm curious,
So,
Missy,
yeah.
have you increased your...
I haven't, because I haven't had the education and the information, and as I mentioned, I'm not a reader, and don't, and really prefer not to. So I'm really curious too, as my treatments change, is that going to affect it? How do I know that what I'm being given from my oncologist is, how's that going to interact, and is there someone that you type that information in and then they say, here's what you do, and then at a certain point, because I know some of my treatments are cumulative, and that's going to be shifting as I go forward. So those are things that it feels overwhelming, and it feels also when it's a life and death sort of situation, you're kind of intimidated and a little nervous, and you want to believe, and then you're going, oh, am I believing just because I want to believe and I need to believe? And
what would you say to that?
Yeah, there's still so much we're learning about this medicine. The research we do have shows that cannabis actually enhances radiation therapy, enhances chemotherapy. There's some new evidence coming out that maybe certain chemotherapies, the cannabis and the chemotherapy actually sort of compete at the liver where they're both metabolized. So unfortunately, the short answer is we don't exactly know yet. And we're learning with our patients as we go along. And so for you, we were talking earlier before we started filming, but like for you, I would recommend just like ramping up your cannabis dose as much as you can to help fight that cancer. And like honestly, I can't say, especially because I don't know what chemotherapy agent you're on, but I can't say for sure that you're going to get the great outcome that we all hope for. But I think you're setting yourself up for much more success by using this plant that we've seen. Like we do have evidence out there that it's treated cancer and cured cancer.
Something also I'd want to note too is the tolerance, because some people talk about tolerance to the side effects versus tolerance to the actual pain relieving properties. And for us, we've seen tolerance gain to the side effects, say the psychoactivity, in humans, and some of you've seen something different, approximately 3 days is what we normally see.
Wow.
Yeah, but depends how much you take. We believe in small and slow increments. We actually recommend 2.5 milligrams as the starting dose, and depending on what you're trying to treat, sometimes we usually recommend 3 times a day before each meal, sometimes before bed.
Okay, and this is another thing. Okay, I'm not going to lie. You say milligrams, all right. I'm going like, tell me how many drops, right? Or what is that?
It depends. You have to be very careful. It's a really good thing that you brought up, because every medicine is different. Every concentration is different. Every product maker has something different. So ask questions. ask and find, like ours is written on the bottle, but you can ask, you can find out exactly how many milligrams are in that medicine. If it doesn't have it there, buy another medicine.
That's a good point.
Yes, that's my exact advice
Labels
all the
are
time.
important.
If you can't tell what's in there, if it's not clear, like that's not what you want. Yeah. Get something else.
Do you need to be testing this at home?
You can.
Just only because of any kind of the effects. I remember that I asked my oncologist once, I go, I really want to have a drink and enjoy myself. And they said, well, test at home so you don't throw up on the bartender. And I'm like, well, okay, so is that sort of the same kind of scenario? Do you need to test this at home so that in case the THC is
Definitely don't drive.
I know, that's the only thing is, when do I test it at night before I go to bed? So if I get to, there's not really anyone that tell you, and obviously you want to still continue to function, and I don't want my grandkids to see me laying on the floor.
That's why you start super small. We call it sub-therapeutic dosing, and you start there, so you're most likely not going to have any negative side effects. And then you slowly increase. But yes, starting on a weekend is usually what I recommend.
So here's an issue, opioids, right? There are a lot of people who are prescribed them. I'm sure you've been in the past. I know I have. I don't like them, and I want to use cannabis, right? But then I don't know what to do because I'm a little afraid of mixing those two things together. So what's your advice around that?
Yeah, and it's so common. There are so many patients out there already on opioid medications. They want to stop using them, or I have a lot of patients who come in pain and want to avoid starting opioids. This is a huge topic right now because obviously our nation is dealing with a really big heroin and opioid epidemic that are tied together. So cannabis is awesome because it actually it works together with opioids. So actually people do find that when they start using cannabis as a medicine for their pain, they're able to reduce their use of opioids. It's very important to reduce opioids in a sort of like titrated step down way.
You mean really slow?
Like very slowly.
Titrated means really slow,
Very
right?
slowly.
Okay.
So it can be dangerous to stop opioid medications altogether. They're severe withdrawal side effects that can happen. So usually for my patients, if they don't feel comfortable going to their regular doctor to talk about how to come down off of their opioids in a stepwise fashion, which is what we encourage, if they prefer to do that with us, that's fine. But we do help them set up a program where they're gradually decreasing the opioid dosage while increasing their cannabis dose. And over time, most people are able to come off of the opioid medication altogether. And they find they get much better relief. They don't need to keep ramping up their cannabis dose the way they had to keep ramping up their opioid dose. And they're not having the side effects, right? Opioids come with a lot of side effects where you're loopy and you're not sure what's going on. You can avoid that with cannabis, but still get amazing pain relief.
Well, and I think, Missy, you have a really good story about a kid who was using opioids. And actually, didn't you dump out your mother's purse also and find a lot of opioids before you invented
that's
the
why
right
we
patch?
made the patch, basically.
Well, and I'd love to hear that story, Missy, because I think a lot of parents struggle with kids who are being prescribed these very harsh adult medicines.
Right, and it's not that you want to go against doctors' orders because you feel like they're your healers, so you have to listen to what they say. But I was talking with someone about this, and there's a young boy that had cancer and was being treated with opioids. I'm sorry, and he wasn't working. He was doing incredibly terrible. He was only 7 years old, and he had cancer, and it was really it's heart-wrenching to know that the parents had to sit and watch that. So they made the choice to, without the doctor's permission, to take him off slowly and appropriately and from the opioids to the cannabis, and started treating with cannabis. He turned around 100%. He started eating again. He started doing, and he's now 8 years old, and he came through it. And the parents now knew it would work, but they were afraid to tell their doctor. They didn't know what to say. And when they went to the doctor and explained to him what happened, he's like, "Well, whatever you're doing, keep doing it. You know, I think it's obvious it's working really well." And so it made me realize that there needs to be people like us that are advocates too. It was just one more reason that I just felt like more people need to talk about this, because it's really an important opportunity to change.
Well, is there anything we think that people need to know? Did you have any other advice we should bring up before we close this out?
I think it's really important that we all open this conversation up, because I know there's a lot of people that I've run into just in the last few months, and this conversation is so important. And coming, what I said, I came out. You know, I've I'm coming out about the fact that I'm going to use this for my treatment, and I believe in it, and I believe it's going to help me, and I believe it helps a lot of other people. But that you have to feel comfortable, you know, with people around you to tell them this experience. So,
and I think that's really important too, talking, because it is sort of an uncomfortable conversation sometimes to bring up with your friends or your family or your doctor.
Right.
And I coach people to like really talk about your cannabis medication in terms of how it's made you better, what it's done for you, right? Because we're so sort of accustomed to talking about it, oh, that's a bad drug, it makes people high. But if you go and you say, hey, I am in so much less pain, I'm eating better, I feel more energized, it's really hard to tell people to stop doing that.
right, yeah. It should take away those mysteries.
There's nothing more motivating than a loved one in pain, right? And that's sort of a lot of our catalysts on this journey was finding that relief for our loved one. And in my case, I had a dad who was a physician who was a very just say no. And once my mom, I found out that she wanted to try some alternative cannabis therapies, my hardest conversation was then with my dad. And I was so surprised that he was absolutely for it. He could not just say no once he saw this happening to his wife, and he had to help get her out of the pain she was in. So, and as we've traveled around the country, meeting with herbalists and doctors and naturopaths, as many types of cannabis and cannabis therapies as there are, we're just finding that there's no one size fits all. So really you have to research and try and seek advice from scientists and doctors and reputable product makers so that you can get the effects of the intended relief that it's going to give you.
Well, I think what I hear you saying is don't give up, keep trying, but you're going to have to be willing to experiment for yourself. And with that, I'd just like to thank everyone here and say thanks for listening. I hope you got something out of that will be helpful to you, and we'll talk to you next time. Thanks.